Hello, I'm Dr. Cynthia Earle, audiologist and owner of Asheville Audiology Services. I'm going to do a series of videos here showing you how to clean and take care of your hearing aids. One of the biggest reasons hearing aids go back for repair is the lack of cleaning on the patient's part. If you've heard the saying, cleanliness is next to godliness, it's really true when it comes to hearing aids. We're going to start first with behind the ear hearing aids. I'm going to show you how to clean 3 different types of behind the ear hearing aids with 3 different types of attachments of ear molds. So I'd like to direct your attention first to a hearing aid that we call a behind the ear hearing aid with an open fit. The open fit means that we have a thin tube with a soft little tip at the end. Now, on this hearing aid, this little cover right here on the back is the cover that protects your rear microphone. You can see it's tiny, it's got little crevices in it, and it really doesn't take a lot of oil or dead skin and debris to clog that up. The other microphone opening is up here in this white area, this triangular area here on either side is the cover for the front microphone. So most of my patients, I tell them at night before they go to bed and they're putting their hearing aid away, turn the hearing aid off, take the brush we give you and brush first around the rear microphone, both ways, sideways and up and down, and then go up here and around the front microphone on either side and give it a brush. Now, you may not think that you're doing anything when you brush it because dead skin's invisible. I read recently that we shed 40 to 50,000 cells of dead skin every minute. And one of the biggest reasons these will go back for repairs is people will not brush them. Of course, when they're not brushing them, they're not working, so it's like a kink in a garden hose. But over time, that oil and debris gets down inside the microphone diaphragm, and no matter how much I attempt to clean it in the office, I have to send it back to the factory, and if the hearing aid is out of warranty, there's going to be a charge for that repair that you really didn't have to incur if you had taken the time to brush the hearing aid off. Now, the soft little tip. This is a tiny little opening. We definitely want it to stay free of debris. So after I brush the rear microphone and around the front microphone, I'm going to brush across the little tip, that little opening. Now, if I brush it and I did this and there was anything there, all I would be doing was forcing it back in. So when I brush the soft tips, I hold the brush up, take the tip, and I just run it across there so the bristles are going up inside, knocking anything out that would be there. Most of the time it would knock it out. Now, every so often, these things won't work, and it's simply because there's a little piece of debris or wax up inside there that has lodged, and no amount of this is going to get it dislodged. So, you have in your repertoire a jar opener. I'm going to take the jar opener because my fingers aren't as strong as they used to be, and I'm going to pull this with a Widex hearing aid. You pull it straight apart. With some of the other hearing aids, it actually screws off. But I pull it straight apart, and then I take one of the filaments I've given you. I take this filament, I start here at this end because I want to push it out. I don't want to work the debris all the way back up into the tube. And I bring that all the way out. And you can see that if there was something there, or a piece of moisture, maybe from going from a hot outdoors into a cool indoors, you'll get some condensation. That's going to clean that out. And voila, the hearing aid will begin to work again. Also with these soft tips, all my patients know, like this one here is looking a little bit waxy, a little bit yellow. Once a month, I encourage everyone to pull the tip off, the hook and the tip, and you soak that in warm soapy water. Dishwashing soap's great for 10 minutes or so. Take it out, rinse it off, lay it on a paper towel. It takes forever and a day to dry off. You have another tip hook that I've given you, and you're going to use the other one in the meantime while this one dries. And then a month later, you're going to rotate them again. Even though this should be dry a month later before you put it back on, I still encourage you to run the string through there and make certain there's still no water droplets left in there. So that's cleaning the open fit instrument. Now, some patients can't wear these soft little tips because they won't stay in their ear. So they have a custom earpiece made. This custom mold, we took an impression and it's shaped just like your ear. So with these, you never take them off and give them a bath. You take a cloth, a tissue, and you can wipe that piece off. We still want this little opening to stay free of debris. So again, after you brush the hearing aid, the front and the rear mics, you're going to take your brush, you're still going to hold it upside down, and you're going to knock that against there, so that more than likely, if there's anything there, it's going to drop out. And if it does, you're not hearing out of the hearing aid and you know your battery's okay, just like the other piece, you're going to pull this off. You're going to take your filament and you're going to run your filament through the tubing. And if there was anything there that the brush could not dislodge, you can see that that would push it right out. So, thin tubes, open fits, one of these two pieces, that's how to clean it. Now, the other type of behind the ear hearing aid is one where we have a thicker angle piece and a thicker tube. This is for more severe losses. These ear molds here, there's no electronics here. So with these, again, you're going to brush the rear mic. You're going to go up inside on either side of this opening on the little angle piece, and you're going to brush around the front mic. You can take a damp cloth and you can wipe this off. Just don't wipe the hearing aid off with dampness. And I've also given a little tool here, a little scooper, and you're going to go up inside here every day in that little hole, and you're going to scoop any debris out of that opening. So that's like a little shovel, and if there's anything there, it's going to pull it out. Once a month with these, I encourage everyone to take the earpiece off. Again, I'm taking it off where the tube and the piece come together. You don't want to remove it by pulling the tube out of the ear mold or pulling the angle piece off the hearing aid. You want to pull it right there. And you need to do this at night. You can soak that again in warm soapy dishwashing soap for 10 minutes, rinse it off, lay it on shake it, lay it on a paper towel to dry overnight, and the next morning you can reinsert it. So, I hope that this has helped you understand how to clean your hearing aid. Clean hearing aids, of course, are going to work more consistently for you, and you will reduce repairs down the road. So, thanks again for tuning in.